Hi, it's Jessica DaMassa with WTF Health. I'm here at Health Data Palooza, and joining me right now, I have Simmi Singh. She is a partner at Egon Zehnder, and she is a self-proclaimed student of people. Is that right?
Indeed, Jessica. So nice to be here with you.
Thank you. Thank you for stopping by. So I want to jump right in. And so you were telling me that you do a lot in terms of helping evolve leaders.
Right.
And you have a particular expertise in like policy and in tech and in health and in consumer. And so I want to jump right in because I feel like, especially in healthcare, I don't get to have the leadership conversation enough.
Right.
Even though now, like, the world is changing, particularly in healthcare. It's like we're seeing so much more technology play it's such a larger role in healthcare.
Right.
We're in the midst of a big generational shift. A lot of boomers are retiring.
Right.
The millennials are starting to swell up into the workforce. So it's like, what is it? How do you groom the next generation of leaders? What does the next generation of leaders look like in healthcare?
Oh, it's such a wonderful question, Jessica. And I think, frankly, what is so interesting today is that the world has more ambiguity than ever before. And it used to be that we would think of leaders as people that were experts, somebody who had done something for a very long time. But today, more and more, we think of leaders not just about what they have done, but what they can do. It's the elements of potential that we do a lot of research in. So do you have an above average appetite for ambiguity? How do you do in terms of curiosity? Yes, you are extraordinary yourself, but can you bring out the extraordinary in others? Because change management and leadership is a team sport, and it's so much about our ability to infect others with the contagion of enthusiasm, of passion, to be able to bring out the extraordinary in all of them, and also resilience, right, which is a really, really important thing. So I think the idea of potential, I think, is a huge piece of leadership going forward.
Okay, so I want to know. So, can you build some of those things? Like, how can you practice curiosity? I imagine, like, I know I'm very curious. So
Right.
it's like, and it's like a muscle. It's almost like the more questions I ask, the more questions I have. But
Right.
things like resilience, or things like, like you had said, that comfort level of living in ambiguity.
Right.
How do you build some of those as traits in yourself? Can you develop them?
That's a wonderful question, actually, because, we all have sort of innate traits, certainly, that we're born with, but then we have essential experiences. And experiences are ones that you acquire. You can take risks in your career. I think one of the things that people really focus on too much sometimes is being risk averse and sort of trying to stay in one path. And the fact is, you can go backwards in your career and you can go sidewards, but you have to do it driven by the right instincts, driven out of genuine curiosity and development, and so forth. But I think your question about can you build these traits, I don't think you can invent them out of thin air, but you can absolutely cultivate them, right? So the question is, if you are curious by nature, then how do you channel that curiosity into certain fields of subject matter? How do you take what you learn and actually convert it into something usable? So there's always this tension and this combination of the science and the art, which is cultivating a skill set, being very conscious of it, finding great mentors and sponsors who can help bring that out in you, asking your company or your employer, or actually creating opportunities for yourself that can allow you to exercise, right? Every muscle gets stronger if we exercise it. So it's really important, I think, to do that, to take a trait like curiosity and to build it out. When it comes to resilience, I actually think that many of us, we grow up as overachievers, we've learned to succeed our whole life, right? But learning to fail is an amazing skill. And that's something I really look for in leaders, which is, can they embrace their failures? What have they learned from them? Are they willing to fail again? And you want to fail in different ways, not in the same way all of the time, of course, if you can help it. But the fact of the matter is that, even when you're interviewing candidates, right? When you say to someone, tell me about the darkest day at work, you can immediately see some people get defensive and shy and ashamed about it. Others sort of say, oh, I have a list of things that I've done, poorly. One of my, I failed miserably the first time I created a business, and I talk about that all the time because it was one of the most instructive chapters of my career. And actually learning to recover was a wonderful skill. So I think experimentation, the willingness to put yourself out there, and the willingness to seek help and guidance and mentors and experiences that can shape and cultivate and sharpen your edges. Self-awareness is another big thing. I think you have to be very aware of what you don't know, what you can try to do, how people react to you. And so this idea of self-awareness is very big. And I guess the last trait I would think of that's a really important one, and this one I'm not sure is developed as much as it's innate in some people, but one should really work on it, is personal security. Right?
What does that mean?
It means, are you comfortable in your own skin, right? Because you can either be, one of my mentors used to tell me that arrogance and insecurity are two sides of the same coin, you know?
That's interesting. Okay.
Right? And at the same time, I think confidence and humility are two sides of the same coin. So if you're personally secure, then you don't mind asking a question. You don't mind being the person in the room who was wrong. You don't mind that others know more than you do. In fact, you seek it and you embrace it. So I think being centered in who you are, as old-fashioned as that is, being self-aware of who you are, surrounding yourself with the best. You know, my dictum is, if I'm the smartest person in the room, I go find another room. Because actually, we should never be the smartest person in the room.
I want to ask you about the room then, and the people in the room. So how is a leader, like what is your best advice for building like a leadership team? Because I mean, already like the traits that you're describing, I'm like, I want to work wherever this person is leading, because it sounds like a great environment, and
Right.
you know, and you want to be a part of that. So do you have any special tips or tips or tricks, excuse me, for building a good leadership team?
I think values. You have to practice what you preach. You have to be incredibly consistent, and in matters of principle, you have to stand like a rock. Because the fact of the matter is that most often leaders get tripped up when they make exceptions when it comes to values, right? You sort of mandate a certain behavior on others but not on yourself, or you give some people a pass and you don't give other people a pass. It's just like parenting. When you are not consistent and really standing like a rock with principles, then people don't have trust. And so I would say the big characteristics of building an amazing leadership team is allow yourself to trust others, but never forget to be trustworthy. You have to earn trust. It's not something that's given. You have to earn the right to be a leader. It's not something that's given, right? We can all lead, but we have to worry about followership. And so I think a great leader surrounds himself or herself with people who have strengths where he or she have weaknesses, people who think differently from you and can challenge you, people who care deeply about mission in their gut, and people who love to share and love to learn. So I think if you have a leadership team that's deficient in its ability to learn, it becomes closed-minded. If you have one where your intellect is the ceiling of the room because you're the smartest person in the room, heaven help you. You want to have smarter people in the room. You want to have different thinkers. You want to have people that have a deep passion for the cause, but people who care about each other. Love is such an interesting trait. And I think, you know, we think of leaders as having sort of traits, right? There's the lover in us who cares. There's the dreamer in us who's the strategist. There's the thinker in us who's sort of the analyst, right? And there's the warrior, think peaceful warrior, right? Like Gandhi or Mandela. What power did Gandhi have? This was a thin man in a lion cloth who took on the British Empire. What power did Nelson Mandela have in a jail all by himself? It was the power of not sitting down. And we work a lot with actually Erica Fox, who sort of, wrote this book about this model and sort of really being aware of the different facets of your personality. And that really resonates with me.
I want to ask specifically about healthcare. Sure. So is there anything, as far as being a leader in healthcare,
Right.
Is there any particular trait that you think either has, just based on your experience encountering so many leaders and consulting in the way that you do,
Right.
healthcare leaders have this in common? Or is there a trait that you think works really well in a healthcare environment?
I think in general in healthcare leadership roles, your influence far outweighs your authority. We're a very matrixed industry, right? In a hospital, the CEO of a hospital, 90% of the people walking through that hospital don't work for that CEO technically, right? You can't run it like a corporation. So I think the ability to influence others and the ability to set a direction and then be able to syndicate that among a community of like-minded people, that is probably a very, very pronounced trait. The second is a sense of mission, a sense of right and wrong. The trade-offs we make every day are so complicated, and the complexity of healthcare per square inch is huge, And the fact is, healthcare is the number one and number two employer in almost every community in the United States. So you have a stewardship of the community. You have a duty to be accessible to them. That sometimes goes against traditional capitalist rules, right? Yeah. If all the hospitals in a state were losing money, we wouldn't shut them all down. And so healthcare is fundamentally different. And I think respecting that it's life and death decisions, respecting responsibility to the community, but being able to be fiscally responsible within that, the ability to see gray, that is really, really, really important. I would say this, for leaders who are changing healthcare today, more and more the kind of leader that people are seeking the most and finding the least of are people who have spent time in many different silos in healthcare. So I would say for young people, please, if you by all means you found your passion and you want to be, a physical therapist all your life, or you want to be an oncologist for life, please be that. But for the rest of us, I think taking a tour of duty across different silos is the most important thing you can do. Walk in the shoes of a clinical provider by being one or by working closely with one, then go work at an insurance company, go work at a pharmaceutical company, spend time inside government, right? Being natively bilingual in the language of public and private sector, really, really important. So I think being on a rotation program of your own and a walk, if you will, through the metaphorical healthcare outback is probably one of the most critical things you can do to be an outside-in and inside-out thinker in healthcare in the future.
I love that advice. I was going to also ask, speaking of outside in, drawing from the other industries that you have experience in. It's so funny because where we're at right now in healthcare, everybody's talking about, the consumerization of healthcare. Yes. So we're becoming more of a consumer business, and tech is what's driving that. And so this whole health tech world now, what have you seen from leaders in those industries that we're missing here in healthcare? So if we were to borrow traits from either the tech industry or we were to borrow traits from the consumer business world, what kinds of traits should we be cultivating? I'm going to use your word, to be better leaders in healthcare as our industry starts to become more like those.
That's a wonderful question. I think what I've learned from social media, for sure, is and leaders in social media is agile thinking at the most, right? They change constantly because they listen to the voice of their consumer, and it's built into the design of their product. So I think design thinking and thinking about the consumer as guiding you every single day, as your advisory board being your customer, is something that the consumer and the tech sector does incredibly well. The other is to really use the toolkit, right? So if you're a journalist, you know that every time you write an article, you have to earn the right for somebody to read the next sentence because your sentence was good. Otherwise, the abandon rate is really high. Yeah. We feel in healthcare often very entitled to the attention of customers, but actually we shouldn't. We need to have that mentality of earning it. How do you earn attention? How do you participate? Design thinking, I think, is a huge piece of it. There are so many brilliant people who design interactions so they feel natural to us, right? Whether it's a Airbnb, whether you think of any of the addictive social media networks and so forth. We talk so much about addiction, about things going viral, about being an Amazon Prime family, about those kinds of things. I think that kind of design thinking and agile, rapid development and a constant pulse on the heartbeat of your customer, those are things that I would bring in from consumer and tech into healthcare, because we make such a huge difference in the world, yet sometimes we're so caught up in the institutional behaviors that we have that we think like B2B people. For an industry that serves consumers every day, we're wholesalers in our mind. We should think like viral retailers and really, really be agile every day and listen to every voice as if it's coming from within us.
Simmi, I love this advice. Thank you so much. I could chat with you all day. Thank you. It's been a pleasure. I'm Jessica DaMassa with WTF Health here at Health Data Palooza. Thanks for joining us.